So I'm one of the pre-kidney transplant coordinators at Stanford. My role is to help patients prepare for transplant, bring them to the point of transplant, and then we have a separate team of nurses who help patients through the post-transplant period. I'm going to talk to you today, or hopefully answer some of the questions that were submitted to me about the following topics. So transplant candidacy, the transplant waiting list, approximate waiting times to receive a kidney transplant, and multiple listing. So first I'll talk about the transplant candidacy. The purpose to become a transplant candidate, you have to go through an evaluation process. And the purpose of our evaluation process is to assess whether or not the benefits of transplant are going to outweigh the potential risks of putting you through a kidney transplant surgery. To make this assessment, we review your history, so basically your medical history, your psychosocial history, to make sure that you're healthy enough and strong enough to undergo the stress of a transplant surgery. And as Kathy mentioned, social support is vital to be able to have a successful transplant. So we're going to want to make sure that you have the support team in place to help you take care of this new kidney after transplant, and that you will be able to take care of this new kidney after transplant. So once we've made the assessment that we feel that you can successfully go through transplant, we accept you as a candidate. But accepting you as a candidate doesn't necessarily mean that you're going to get a transplant tomorrow, or that it guarantees that you will get a kidney transplant. What it does is allows us to place your name on the kidney transplant waiting list, so you can start accumulating waiting time. Accumulating waiting time is the really most essential factor that determines when you're going to get a transplant. You basically have to wait your turn until you're at the front of the line to get a kidney transplant. This rule is unique to our region, so Kathy is here representing the California Transplant Donor Network, which consists of 3 transplant hospitals: Stanford Hospital, UCSF in San Francisco, and California Pacific Medical Center in San Francisco. So all 3 hospitals, all the patients at these 3 hospitals are waiting in line together. So there's one list that covers our region. So once you're on the list and accumulating waiting time, when are you actually ready to receive a kidney transplant? So we've done the initial assessment, but before we actually put you through a transplant surgery, we're going to want to check your systems, or that's the way I'm going to refer to it. We basically want to make sure that we have checked these areas. Medically, that you're physically strong enough and healthy enough to undergo a transplant surgery. Psychosocially, that you'll be able to take care of this new kidney transplant. And also, as part of the systems check, we'll need to make sure that you have adequate insurance coverage, because you will need to take immunosuppressive medications after your transplant, which prevent you from rejecting your kidney. And you'll need to take those for as long as that kidney is going to work for you, which can be many, many years. And so we want to make sure that you're going to be able to get the medications that you need after transplant. So as part of the systems check, medically, we may also ask you to do some additional testing that you did not do as part of your initial evaluation. So for example, we're always interested to know what the status of your heart is, because when you go through transplant surgery, that does put stress on your heart. So we want to make sure that it's going to function properly and provide good blood flow to your new kidney. Another test that we may ask you to do before we can completely clear you for transplant surgery is a test where we look at the blood vessels in your lower abdomen, because these are the blood vessels that we would need to use to hook up to your new kidney transplant. You're receiving an organ, and that organ is going to need good blood supply. So we need to make sure that your body is going to be able to provide that good blood supply. So that's just an example of some of the tests or systems that we might need to check before we can completely clear you for transplant surgery. Once we've been able to check off all 3 of these areas, then we can activate you on the list. So far you've been on the list and accumulating waiting time, but you're not yet eligible to receive a kidney transplant offer. That happens once we change your status on the list to active. And there are only two statuses that you can be in on the list, inactive status or active status. But please note, this is very important, that in both statuses, you will always be accumulating waiting time. So, if at some point we are able to clear you for transplant surgery and your case is active, but then, for example, you end up, having a knee injury and you need knee surgery, we would need to temporarily change your status to inactive while you have that surgery and recover from it. Afterwards, we'll change your status back to active, which makes you eligible to receive kidney transplant offers. But throughout that whole period when you're inactive or active, you're always going to be accumulating waiting time. So the clock never stops ticking. So when do you actually get to the point of receiving a kidney transplant offer? If you're listed and let's say a year later we're able to check off all your systems and activate you on the list, you're technically eligible to receive a kidney transplant offer. But in our region, since receiving a transplant is most always based on waiting time, these are the approximate waiting times to get to the top of the list. And one of the questions that was submitted was, well, why is blood group O so much longer than the rest? And I don't know that I have the answer, but I can guess at why that is. One reason is that blood group O is the most common blood type. So we have, the largest number of people waiting for kidney transplants in that blood group. And the next question then is usually, well, but if blood type O is the most common blood type, then shouldn't that also have the greatest number of donors? And I don't know that I can answer that question. I think in general, all of these waiting times are created because of the difference between the number of people who need transplant and then the number of donors that we're getting. Okay, so when you're on the list, one of the most common questions is, well, when am I going to get a transplant? And besides looking at these numbers, which are averages of how long it's taken people, in the past couple of years to get a transplant, besides that source of information, what I also look at is a list of people in our region who are active on the list. So this only shows people who have been completely cleared for transplant and are ready to receive a kidney transplant surgery. And this list is provided to us every 3 months. So as you can see here, this is just a mock-up. It will show the patients who are listed at our center. So of course, we're not going to get information about patients listed at other transplant programs in the region. But it does, what's unique about this list is it does allow you to see where you are in relation to the other active people in the area. So in the second column is the center where the patient belongs to. So CASF is University of California, San Francisco. The ones highlighted in yellow are Stanford. And then CAPM is California Pacific Medical Center. Now, this list only gives you a picture of the patients who are active on the list on a certain day. So it's constantly changing. There are people who are either getting transplanted and therefore kind of taken off this list, or there are patients who are becoming activated and may have had more waiting time than you and will now show up in front of you on the list. So I know this can get kind of confusing, but maybe if I give you an example, John Green, he's number 7 on the list. If I was talking to John Green, I might tell him, yes, you're definitely getting close to the top of the list, but as you can see, there are still candidates in front of him. And I might estimate that, it might be somewhere around 3 months to a year before you start getting transplant offers. If I talk to John Green 3 months later when the list is published again, it can happen where he's 7 on the previous list, but maybe now he's 12. Because there are 5 patients who have now been able to check off all their systems and are active on the list, and now will show up, whereas last month or 3 months ago they did not. So it's really, it is a moving target, and so we just use it to help us estimate approximate waiting times. So hopefully that's answering some of the questions that I received about, candidacy, the list, when are you able to get a kidney transplant. And then lastly, I just wanted to talk about multiple listing. So you do have an option as a patient to be listed at more than one transplant program or in more than one transplant region. And I want to make sure that I kind of explain what that means. So this is a map of California, and the colored areas show the California Transplant Donor Network region. And as I mentioned, there are 3 hospitals in this region. So all of our patients are waiting in line together on this same list. If you're interested in trying to get on another list, then for example, the next closest region will be the whited out region in central California. And that includes 2 transplant programs, both around Sacramento, UC Davis and then Southern in Sacramento. The first step in trying to get on more than one transplant waiting list is to talk to your local nephrologist. So they can refer you to these other programs, and you will need to go through their evaluation process. If you're accepted as a candidate there, you can be listed there and also listed at Stanford. So I know my portion was brief, but additionally, resources that you have to kind of educate you about the transplant process are a couple of websites. So there's the ustransplant.org. That gives you statistics on transplant outcomes at each individual transplant program in the country. So you can actually go to this website. It will show you a link to get to this database where you can look up each individual transplant program and look at their transplant outcomes. That might be a good resource if you're interested in multiple listing. Secondly, here is the Stanford Kidney Transplant and Pancreas website. We just revamped this, and it can be a good source of information if you're interested in finding out what programs are unique to Stanford. So what do we offer at Stanford that's kind of unique to us? And then, of course, please don't forget your transplant coordinator. So I'm one of the transplant coordinators at Stanford, and all of you, if you're evaluated, will have a transplant coordinator assigned to you. So we are here always to answer your questions, and if we can't answer them, we'll try and help you get the answer. I did bring some additional material, which is at the back, on the back table, on the back corner of the table. It's business cards for myself and Dr. Busk. Also, there's pamphlets about the evaluation process, the living donor process at Stanford, and pamphlets about multiple listing, and also about the expanded criteria donor program, which we didn't have time to touch on, but there is basic information about that for you on the back table. Okay, thank you very much.
Thank you.